the
membership list.
The draft of the social services checklist that we have, the draft of it. I'm having trouble finding the last version with the edits. Good evening, everybody. Welcome to Community Board 4, Housing, Health, and Human Services monthly meeting for January 2022. Thank you for joining us. If it is your first time, I will give my quick spiel about, my name is Maria Ortiz. I'm co-chair. Joe Restuccia is the other co-chair. Oh, excuse me, Maria Ortiz. And this meeting is held the third Thursday of each month. Per the governor's order, we're still able to meet remotely. I don't know how long this is lasting. However, this meeting is also being live streamed on YouTube. It'll be accessible there as well. The agenda and the materials for tonight's meeting are, they can be viewed on the website. Also, I encourage everybody to join the listserv if you're not currently on the listserv, to find out more information about these meetings as well as other committee meetings. If this is your first time, what happens is there's presentations. After each presentation, the committee is going to ask questions first. The committee will ask questions and make comments, and the members of the public or the attendees will get to ask questions or make comments. Next, the discussion goes back to committee. On some agenda items, the committee members vote to write a letter of support, make recommendations, etc. After each presentation and after the committee speaks, what I'm trying to say is, in order for you to speak when it is your turn, if you're an attendee, we need you to raise your hand. It'll be on your screen somewhere on the bottom. And if you are calling in, I saw someone is calling in. If you're calling in, you're going to press *9 to raise your hand and *6 to unmute. Again, when you call in, *9 to raise your hand, *6 to unmute. Tonight on the agenda, we have number 1 is a presentation regarding a syringe, rubbish, and disposable kiosk installation request on Dyer Avenue. The second thing we're going to be discussing is the inclusionary housing proposed applicant guidelines and the social services providers checklist, which is also in draft. They're both in draft. And then we'll do some updates, one on the drop-in center on 9th Avenue. Second, it'll be the former Aladdin Hotel at 317 West 45th, and family shelter closures, and then new and old business. I should say also, let me just check myself. The committee update on the drop-in center is 771 9th Avenue. Joe, want to take it away?
A few things for expectations. First, I want to make an announcement that as part of our work in the committee regarding the Housing Works proposal for the MTA site, the board decided that the social service portion of the proposal is coming to our committee at our next February meeting. That's February 17th, I believe. So we'll be inviting them. Jesse's working on that to deal with the social service plan and aspect, not the building, the social service plan and aspect. So we're reaching out to them. So everyone should be prepared for that discussion in February. Second, for our inclusionary housing checklist, this is our third go at the document. So tonight we will be adopting it. Everyone has been adding in over the last 3 months, so we can move that ahead. I would expect the process to be extremely similar for the social services provider checklist that we've been working on. So I would think the earliest we could adopt that may be the April meeting, most likely. We want to give full back and forth to the committee members and the public on how we create this document. And then given that, I'm going to ask Nellie to put up the presentation for Housing Works. And Richard, if you can introduce yourself, your role there, and then start description of this process. This project.
Thank you, Joe, and thank you, Maria. My name is Richard Perkins. I am a harm reduction specialist here at Housing Works. My role entails primarily providing in-person services for mostly unhoused people who have needs surrounding their drug use, whether it be reduction of drug use, connection to healthcare, cessation of drug use. And our facility is also a syringe exchange program. Part of the caveat of having a syringe exchange program is also our responsibility for removing any syringe rubbish that is found in the area. We have an outreach team that goes out twice a day to outreach to people, but also to collect anything that they find in terms of syringe litter in the streets. We've also worked quite closely with Hell's Kitchen Hudson Yards Alliance and Gramercy, the Garment District Alliance to train their maintenance staff as well on safe syringe collection and disposal. And we offer trainings to any organization or entity that wishes to find out more about that. But also, if anybody has any concern areas, rather than maybe notifying 311, feel free to reach out to me. My information will be on the next slide, and we could always send staff over. Part of our efforts as well, in conjunction with the Department of Health and the New York City Council, they've made available several of these sharps disposal kiosks. We currently have one that's mounted onto the external wall of our facility within our property line for any 24-hour deposits of any sharps. And we are looking to see if anybody in the community, we've reached out to a couple of community-based organizations, and we're running into some concerns, obviously, from landlords. But we're open to placing them, internally inside buildings if anybody has facilities where they notice there's a lot of syringe litter in the area. This would be something that would be installed by Housing Works, it'd be maintained by Housing Works. There's no access to the public, everything is padlocked. The only access is a top slot to deposit supplies, and it holds up to 28 gallons. One of the ideas we had noticed was there's areas surrounding Dyer Avenue, which has been a real hotbed of public use, something that we're obviously appalled to see, and also we have to walk across pots and planters with disposed syringes, and that really is not anything we want to see in this community. Whether or not something could be installed either on Port Authority property or any other building owner in that community, to where people will have something that's a little more visible to them, so they're not disposing of syringes just willy-nilly on the street in the subways. That's really all. I'm not going to take up much of your time, but like I said, these are going to be containers. We're currently working with the Parks Department in the East Village, for instance, and in Fort Greene, Brooklyn, to get some installed in those areas because they've had a lot of community concerns with syringe rubbish. And we're just looking to see if anybody else in this particular community, surrounding our facility, see a need for that. And then if you want to go to the next slide, that just gives the information to reach out to me. Feel free to reach out to me via email or via phone anytime. And yeah, I'll gladly take some questions.
Can you put the prior slide back up, Nellie?
Sure. I'm sorry.
And just a specific question. Where is your proposed location in the community for installation?
So this is where the community comes in. I'm looking for proposed interests, if that makes any sense. We've identified some hotspots where we find a lot of syringe rubbish, and it includes areas, like I noted, Dyer Avenue. It includes areas such as the intersection of 40th and Broadway, where there's a lot of disposal within the subway system. And we're just, trying to get the word out to the community. First of all, if they have any hotspots that they've noticed where there's lots of rubbish, we're more than happy to come remove the rubbish. But also, if anybody who's listening in, anybody on the committee who knows of private entities or buildings that would be interested in receiving one, we're more than happy to install on site as well.
Thank you. If you can unshare the screen, and let's start out with JD, followed by Katie Stokes.
Yeah, thank you, Richard. I just have two clarifications. I don't know if you know the answers, but one is, why is the area, in your opinion, around Dyer Avenue, why is that so full of needles?
I think that area it's been sort of a hotbed of both homeless encampments as well as public use, because it's sort of out of the way of most, pedestrian passerby, I guess. It still has an air of sort of, it has a liminal air to it. only because it's sort of bereft of people. So I think it's easier for people to set up encampments there. They're not being watched as heavily. It's a lot of tunnel traffic going through. So it seems to be an area where people feel safe, removed from the public.
You said tunnel traffic, Richard?
Like the Lincoln Tunnel, you know, so there's a lot of inroads in that area heading into the Lincoln Tunnel. So it's a fairly you know, Robert Moses road driven area. So so I think that precludes why people are using that area.
Okay, my second question is, and again, I don't know if you know the answers, but diabetics also use needles and need to dispose them.
Absolutely.
But this seems to be not focused on all Sharpie disposal, just focused on drug use disposal?
No, not at all.
Oh, not at all. Okay.
Yeah, we have people who are patients in our clinic upstairs who are diabetic. We have staff members who are diabetic who happily dispose of it.
So, but that would not be a convenient place for them, would it?
No, so that's what I'm asking. If there are people, I've even approached long-term care facilities to see if they had a need specifically just for customers. You know, we've had places put them in their lobbies, for instance, you know, so for easy access for anybody who lives in the facility. So we're open to placing these where the need is.
Thank you, Richard. Thank you.
Thank you so much. And just
Katie,
a quick, oh, sorry.
Yeah, go ahead. Sure.
Yeah, just a quick aside. We do have partnerships with like a lot of pharmacies and barbershops in the area, and we take care of their sharps as well, including anything that barbershops just use. So, you know, we do sort of branch out throughout the community, but a lot of times accessing the spaces for the public, they might not know, or they might feel uncomfortable going into a pharmacy to dispose of sharps. So trying to provide a more visible option for people.
Katie, followed by Travis.
Thanks, Richard, for this presentation. It's very interesting. And I'm just wondering a couple of questions. So is there sort of history or evidence that if you put one of these sharps disposal kiosks in an area where typically people are often dropping needles, do they actually, is it used, or is it more your folks who then pick up the needles and then put them in the kiosks?
So we don't put them in the kiosk per se. So when we collect syringes, we have a machine. It's called the Sterilus machine, and it grinds up and sanitizes the material. So that's what we do, and then we have it hauled off. But in terms of what's in the kiosk, we have one kiosk right now in the neighborhood, and we clear it out once or twice a week, and it's pretty heavily used, especially at night. Usually what happens is people tend to bring their syringes directly to us, and we dispose of them through the Sterilus system in office. But what happens after hours, you know, everything is closed, and if the only kiosk is located just by us, then they wind up in those other hotspots. So, so they definitely do get used, and they get used quite regularly.
Okay, great. And my second question is, what is allowed for you guys? Like, have you been allowed to maybe put that one inside? You mentioned that there's like a lot of activity near one MTA station. Have you been allowed to put one there, or would you be allowed to put one on the street?
So
like if a business agreed and the city, I guess?
So the New York City Council does have some strict regulations in terms of placement. If it's affixed actually to the wall of a facility and it fits within the ease of the property, there generally is no issue, but they have some regulations concerning how close something is to a school, how close something is to a subway entrance or egress. They have regulated that these should not be placed on any publicly owned sidewalks or plazas. So they would have to be something that's cleared through private ownership, you know, through a landlord of a facility. We have approached in the past Amtrak, who had agreed initially to having one on site in Penn Station, but now that everything's sort of up in the air with the construction, that's on hold for the time being. We're also working to talk with Port Authority about placing one, perhaps, you know, by one of their bathrooms where we have a lot of people congregating. So yeah, we're reaching out to various entities. I've talked to other community-based organizations, the Red Cross. A lot of these other organizations already have something in place. For syringes, they tend to usually have smaller sort of trash can size containers that they have in their bathrooms. And those get collected by some organization that disposes of them. And we've approached other places. City Parks engages with us quite a bit in terms of Manhattan Parks. Bryant Park, just for aesthetic reasons, chooses not to have one, but they do have a team that is trained on syringe collection, and we go pick up from them quite regularly. And the same with the Garment District and Hell's Kitchen, Hudson Yards. While they haven't necessarily said no to the concept of a syringe kiosk, some of the properties don't lend themselves, both visually as well as practically to it. So what we're looking for is either organizations or building management that senses a concern or has a need. And like I said, this could be retirement facilities, this could be a long-term care, whatever the case is. So
folks, just want to note we have 10 people wanting to speak. So please ask your questions. And Richard, try to be very brief in response. Roberta, followed by Maria.
Thank you so much for the presentation. Super informative. I did want to call out, you just spoke about restrooms. I want to call out restrooms in particularly within the Port Authority and within Penn Station. And I also wanted to call out, I believe there's still a public comfort station in Bella Abzug Park, which is in the area of concern. We wanted to highlight that as a potential interest. Thank you.
Yeah, thank you very much. Yep. Make a note.
Travis, your hand went down. You were next.
Yeah, a lot of my questions got answered. Thank you, Richard, for your presentation. You clarified a lot of things that I was confused about, but I do want to have one question for you. What is the educational campaign around this, or the training around this for local buildings or residents to know how to properly dispose and where to properly take this? Because it still seems like that would be an issue.
So we have a syringe exchange coordinator who can set up several different options. Sort of what we've done with Hell's Kitchen, what we've done with the Garment District is we've actually gone out to their facilities. I think in Garment District, we trained about 35 maintenance workers, specifically on needle stick training, providing correct tools, sharp resistant gloves. We provide them any containers they need free of charge. So when they bring a full one, we just give them a new one. And along with that, there's several other sort of harm reduction related trainings we can offer as well. If anybody's interested in Narcan training, that is definitely something we could do as well. So we're very open, just, whatever the community assesses is their need in that particular instance. We've even worked with private entities like art galleries who've expressed an interest in sort of reaching out to people they find congregating outside of their buildings. So we're very open to talking with anybody who has concerns and, helping them either reach out to us or helping them navigate the issues themselves as well. So we could do full trainings of staff, whatever the case is.
Thank you. Maria?
Thanks, Richard. Just really quick questions. You have one in front of 37th Street in front of your building, right?
Yep.
I only see Joe here. Okay. Sorry. Richard, and it's the same size. In your presentation, in your PowerPoint, there's a size, dimensions that it's mentioned. That's the same size that's in front of your building?
It is. It's about 50 inches high and like 28 by 24, something.
I think I've seen it. And
so vaguely mailbox size.
Yeah. And here's a naive question. I don't know how to ask it.
Sure.
Well, so I'm just going to ask, like if we were on a private Zoom, but we're not. So in my mind, you want to put the kiosk where there's a lot of illicit drug use happening. I'm having a little bit of trouble connecting the dots. If it's someone is using, and they're high, what is the likelihood that they're going to walk over to someplace and dispose of the syringe properly?
So they're not going to walk several blocks, as is evidenced by the fact that we don't tend to have syringe litter within, I would say, a 2-block radius necessarily of our office, because people are aware of where the kiosk is.
I'm sorry, Richard, say that again.
I said that within about a 2-block radius from our office, you don't see a lot of syringe litter. only
Mhm.
because people are aware of it. But where there is no safe disposal, if it's visible, I mean, I'm a former drug user myself, and I was concerned with finding correct places to deposit things. But if there wasn't a
Mhm.
safe deposit kiosk available, I would stick it in a bottle and shove it in the trash can, which was
Mm.
unfortunate.
Mm.
Mhm.
But especially if people are coming to a syringe exchange office, we place great weight on safe disposal with them. A lot of people do return them to us as well. And what tends to happen with that population is they will have a bottle, be it a 2-liter bottle, a coffee can that they
Mhm.
temporarily store things in,
Mhm.
and then they can deposit that into the kiosk. But then you have one-shot users who are in the street who just have nowhere to put it. And so that's where we see something like this being helpful if it's in a high traffic area that's already frequented by people. And then our outreach team in conjunction will also talk to these communities and let them know, hey, by the way, here's the kiosk. So
I've
Maria-
walked, and I just want to share that I have walked on 37th. That's why I thought I saw a kiosk there. And I have to say, I did see syringes on the ground right across the street. And yeah, so I just wanted to share that.
Let's go to one last question from Travis, then we'll go to the public, okay? I'm
Richard,
sorry.
Is it legal to shoot up in public?
it is not, no.
Oh, it's not.
No,
Okay.
no, not at all.
We're going to go to
So-
Travis. I'm
so
sorry,
Richard-
one last. Yes, go ahead, Travis.
So Richard, like given your past experiences and the setup of Dyer, because I've often walked Dyer, and it lends itself to high drug use because you can tuck yourself away, and the structure of it is not well lit. As you said, it's very transient as well.
Sure.
I'm having a hard time now that Maria brought up connecting the dots between a drug user that's ducking off to such a private location to use their drugs, then having the wherewithal to want to dispose of it properly within the proper radius of that location. So how does that connect can you connect that for me? Because I can't see it.
Yeah.
I'm having a hard
And the thing
time.
is, and the thing is, it's not going to be a cure-all for the issue.
Yeah.
Right.
Our hope is to reach as many people as possible through our outreach efforts. We do target those areas through outreach, and we try to collect as much rubbish as we can when we're doing the outreach. But our thoughts would be to really get the word out among those communities. Even when you have sort of the individual groups that are out in those areas, what we found really helpful is trying to find the leader of the pack, if you will. There's always a resident advisor, if you will, who sort of gathers the troops
Got you.
into doing the right thing. And that's what we've relied on in the past for things like coming in to get HIV testing, for accessing our harm reduction services. And we're just going to have to redouble our efforts to reach out, once we have these things in place, to let them know, listen, we can't be just dropping these in the community. Tell your friends, try to watch out for each other. That's the only thing we can do.
Not to cut you off, but Nellie, can you bring over 2 of the speakers, Katie and Brian, while Richard's still speaking? Or else, could I have done that? Do I have access?
No, let Nellie manage that. It's easier. And
Okay.
then also bring over Brian Pelago. So we'll have someone ready to go.
Okay, that's
So
a
the
good
first
idea.
speaker is going to be Katie Savage.
Hi, my name is Katie Savage. I run the Hell's Kitchen Litter Legion. Over the past, almost 2 years, I've really become more familiar with seeing syringes on the street. We mostly clean above 42nd Street. So I don't know how far you guys will roam for collection. I generally call 311, and now I report directly to sanitation, which it's a very frustrating process because there's only 5 people for the entire city as part of the Department of Sanitation that are qualified to collect syringes. So it could be literal days before they get collected. A place that I've noticed is a real hotspot is 48th Street and 10th Avenue. I have been keeping track of all of the syringes that I report to sanitation. And in the last 4 months of 2021, I counted 35.
Yeah.
just in our neighborhood, and that's just me myself. I will say, what Richard was saying about drug users, keeping them contained. There was a pretty large encampment on my block, 51st Street, between 9th and 10th Avenue. I'm sure everyone here has been familiar with that space. Two of the drug users there were actually very good about putting their syringes into some sort of container. I actually multiple times gave them Sharps containers that I purchased on Amazon, and they used them. So I do think, they do that. This has become kind of a passion project for me because I think it's a matter of public safety to have syringes on the street. Kids, dogs, it's, people who aren't paying attention, tourists and flip-flops. Something that I spoke to some friends in Canada about is they actually do have these syringe kiosks very publicly available. They're in most public restrooms. They're all over, and they do not see the same amount of syringe litter that we do since they started putting these in. And they have a lot of the social services providers like yourself that go out and collect this, which I think is great considering now the possession of a syringe is decriminalized. So if that's going to be decriminalized, we need to have safe drop-off points for these items. If people are allowed to have them out in the public, just like we have litter baskets, we need to have more. I understand nobody wants to see that in their neighborhood. I get it, but it's about safety, and it's about keeping the syringes and the dangerous objects off of our street where they can be encountered by children, dogs, pets, all sorts of things, or people just, throw them into a trash can without any protection and a sanitation worker gets pricked. That's very frequent occurrence. So I think this is, a great thing to do. And I'm very familiar with Dyer Avenue. I used to live on 36th Street in Dyer. And I think it would be used in that location. I would love to see something further up here in Hell's Kitchen, or if, I can get connected to some of the social services providers up here to be able to ask them to respond to some of the syringes I see in a more immediate fashion than having to report it to sanitation and it take a long time for it to be collected.
So thank you so much, Katie.
Thank you, Kate. No, hold on. Richard, just take the information in. We can't have a back and forth with every individual speaking, okay?
Sure.
Just take notes so you can respond. Brian Weber next, Brian Pelago, followed by Brian Weber. You're on mute, Brian Pelago.
Hi.
There you go.
Hi, I'm Brian Pelago. I'm a resident. I live on 36 between 8th and 9th. I have two dogs. Walk them 7:30 in the morning throughout the day until 11:30 at night, late night. We walk on at the Canoe, which I'm sure you all know is that park strip area. Walk around the Lewis, which is 35th to 36th, the Webster Apartments, 34th to 35th, and Dyer. Daily, again, multiple times a day. During the height of the pandemic, when the shelter hotels were, had 1,200 unhoused, it was rough and unsafe. And there were, I had photos of maybe 20 to 25 syringes in that 3-block walk. Now I see maybe one or two. Granted, the weather's not great anymore, but my concern is if it was put in that area, again, what Maria had said, would it be used? I had read online, because I wanted to look into this, that this was done in the South Bronx, and it only picked up about 10% out of 80,000 needles that were discarded weekly. And my concern is, again, is if it would attract more drug addicts and or drug use. Again, I don't see that many anymore. I do see panhandlers. Luckily, I just don't see it as much as I did during the year that we had the shelter hotels. So again, I don't know if you can answer that, but or if you know, I just am concerned that it would attract as opposed to help the neighborhood where we just got over having to deal with a rough period.
Thank you, Brian. Going to Brian Weber next, followed by Patricia Maltezos.
Thank you, Joe. And thank you, Richard Perkins from Housing Works. My name is Brian Weber. I'm a public member of Community Board 4. I serve on the Clinton Housing Land Use Committee. I'm also the co-president of the Midtown South Precinct Community Council, and I'm also a resident member of the Garment District Alliance. But I'm here today to speak as a resident of West 36th Street. I also live between 8th and 9th Avenue. The issue on Dyer Avenue with Syringes is not due to a lack of receptacles. It's due to a significant amount of drug activity. As Brian Pelago spoke before me, said that activity has subsided to some degree since the temporary shelters have moved off of 36th and 37th Street, and also through the efforts of the Hell's Kitchen Hudson Yard Alliance, which removed all of the furniture that was there that attracted people to loiter there throughout the day. We still do have drug activity along the Canoe. From my window, I can see the Canoe daily. And as a resident who lives on 36th Street, who walks down Dyer on a regular basis, I'm asking the board to reject the proposal to put a kiosk to collect syringes there. I appreciate Housing Works' efforts to keep the streets clean, but I think it's a misnomer to say that the 2 blocks around Housing Works are syringe free or mostly syringe free. There's a lot of drug activity in the West 30s, particularly on 36th, 35th, and 37th Street, in large part because of the concentration of social services geared towards substance abuse in that area. Unfortunately, attracts a lot of drug sales and a lot of drug use. And while I think our community would be happy to work and have the assistance of Housing Works going out on a daily basis to collect syringes that they find discarded in the sidewalks, I don't think a kiosk is a solution, especially in an area that we are trying to reclaim and make more pedestrian accessible. So I just ask that the board reject the proposal by Housing Works for citing one on Dyer Avenue. Thank you.
Thank you, Brian. Patty Maltezos, followed by, I know it's not Tom Lepre, but that's the name on your screen.
Hi,
Go ahead, Patty.
everyone. My name is Patty Maltezos. I work at the Hudson Yards Hell's Kitchen Alliance, and we are the entity who maintains the Canoe where this proposed kiosk could go. And so we have daily maintenance of this space, and we also have many trash cans on the space, and the needles never end up in the trash cans. So it's our maintenance people who are using specialized tools to remove everything on the sidewalks, at the curb, in the planting beds, in the planters, every place that needles go that is not trash cans. So while it would be helpful for a sharps container so that our guys would not, have to do so much of this, I'm not sure that the needles would actually end up in the sharps disposal versus everywhere else. So we are, we could see this as sort of a pilot project with community board review, but we take this space very seriously, and it's the current sort of setup. It only works because our maintenance workers are daily sweeping for needles, and a kiosk, doesn't come with a staff person. So I just wanted to be clear that we take this very seriously, but I'm not sure if this is the correct tool to help with this. So thank you.
Tom Lepre with a different name, followed by Ann Santora. You're on mute. You're on mute.
Okay. You can hear me now.
Yes.
Sorry, I ended up signing in on my husband's thing because I was having a problem with mine. My name's Cressida Connolly. I'm the board president of Dillon House, which is a building between 7th and 8th on 36th. And along with Brian, I'm the co-chair of the 36th Street Block Association. I have 2 things I want to say. I'm just going to go through them. The first is really specific to Dyer because I have to drive back and forth to New Jersey because I have an elderly mother there. The drug use, the heroin use on Dyer is dangerous because what happens, and I've seen this multiple times, is they come out to ask for money into the traffic lanes, sometimes while they're shooting up or just after they have shot up. And I've literally seen someone in a wheelchair nodding off, rolling down into oncoming traffic. So I think I think the real issue here is to discourage people from being in Dyer Avenue. It's an extremely dangerous place for pedestrians, even if you're crossing, and discouraging them from using heroin there, particularly because it seems like once they use heroin, they're not aware of their surroundings. Someone almost fell in front of my car the other day. The second thing, which is a larger issue, is I'm sure you're all aware of the concept of a sacrifice zone. I think the Soviets may have pioneered it. It's an idea that you take a place, a small area, and it absorbs the pollution you need to create, industry. I'm concerned that our neighborhood is becoming a drug sacrifice zone, that services and tolerance for drug use in this neighborhood is creating a situation where drug users are being pushed into this neighborhood to use. And I would cite the overdose report, which seemed to indicate that a lot of the users who overdose in our neighborhood not only are not residents of our neighborhoods, but are not residents of New York City. So on a kind of larger level, I'm concerned that we're drawing people into this neighborhood as drug tourists. And that I think that I have seen in my own building that families with children, rather than spend a lot of time calling people to clean up needles or hoping that someone's going to use a kiosk, are just leaving. And additionally, businesses are leaving. The coffee shop in the base of our building left because addicts were coming in and trying to rob them. So I guess I feel at this point, I hate to say it because I've long time been an advocate for Housing Works, but I feel at this point that their efforts at sort of harm reduction aren't taking into account harm reduction for the community and are really not thinking about the effect that sort of promoting or encouraging in any way heroin use, further sort of conglomeration of drug use in this neighborhood. And the same thing is going on 125th Street. And those people have my full support because they too are a sacrifice zone, is really having a negative effect on women, children, the elderly, and also men, but people who are most vulnerable, being able to sort of move around in the neighborhood. So that's my feeling about this is Dyer Avenue is not a good situation from a safety perspective, from a traffic safety perspective, but more generally, I would like to see us try and not make this area a drug sacrifice zone. Thank you.
Thank you. Ann Santora. You're on mute.
Wanted to thank Richard for coming in front of the board. I appreciate the fact that you're presenting this and we're all responding. I just want to say quickly that you're catching us at a very specific moment in time. This hasn't been a neighborhood that's really changed quite a bit. Everything was good, busy. Then everything was really, really incredibly bad and dangerous. Many people died during the time that we've just been through. And so I think we're all in agreement that we're back onto hoping that the future might be a little more peaceful. We don't have a lot of green space in our neighborhood, and the canoe park was our only park. It had the planters that you see, it had chairs, and people actually used it in the neighborhood. That it seems like ancient history. It was really our only place to go because it became, as was just stated, the whole neighborhood not only was home to people in the temporary shelters, but far more dangerous. It was home to the hundreds and hundreds of people who serviced them. And I think it's my own feeling that we've made tremendous progress from moving as a drug hub to some semblance where you can go out with your kids or you can walk alone. Before, we used to have to go to the precinct and have an officer bring us home. So the Garbage District Alliance cleans up so beautifully for us. It looks like in the spring we might even be able to go back to where we were to some degree. So we are trying we're already a gateway for, when people come into Penn Station or people come into Port Authority, they're just in Needle Alley. So thinking of cars coming in from the Lincoln Tunnel and seeing a Sharps disposal, it's like, it's just a bad advertising for our little community. And I'm hoping that there will be no little use for it as we move forward and the community can begin to use it as we used to as a park. We could actually sit there ourselves, which we haven't been able to do for 2 years. So I too would ask you to reduce the presence of that and think of us, your neighbors, and give us a chance to utilize the park ourselves. Thank you.
Any other members of the public want to speak on this? I don't see any. Okay, so a few things. First, Richard, I must say that from a presentation point of view, it's very rare anyone comes to a community and says the area is bereft of people. I have lived adjacent to Dyer Avenue for 42 years. If anything, there are hundreds and hundreds of more apartments, hundreds and hundreds of more people on both sides of Dyer Avenue that cross between on 36th and on 35th Streets. So that's not a correct characterization whatsoever of our neighborhood. Second, having been involved with the community board and the Hudson Yards Hell's Kitchen Alliance, we have worked with moving planters around, dealing with issues to try to prevent people from using the actual landscaping and planters as a way to hide and shoot up. There have been, and I want to absolutely say that a majority of people that we've seen, especially in the last 2 years, have not been New York City residents. I have never heard so many Southern accents along 35th and 36th Streets. It's a bizarre moment for me. And it was clear, I worked with a council member who informed us that there were people coming literally from the South who could not get services to Manhattan, and they have to happen to land right in our district. The other issue, very important to understand, which you may not know, is that a lot of the land is owned by the Port Authority. However, the Port Authority has a lease with the Hell's Kitchen Neighborhood Association on a portion of the Canoe and the Triangle and other marginal land. That neighborhood association, the principal there is Christine Berthet and Kathleen Treat. They have indicated to the board they are not in favor of a Sharps container at this location. And then the last thing is, between the bid, I have a full horticultural staff at Clinton Housing. We are cleaning Sharps up all the time. And that's unfortunately part of our work every day now. And it is, I do question the individuals that I am familiar with. I live on 35th between Dyer and 10th. They are not folks who are going to walk over to a Sharps container because, as the woman said, being in the Lincoln Tunnel, there are people who work the area as a combination panhandling / place to shoot up. That is not something that they're going to go and specifically act where responsible. I have another hand up, I'm sorry, from Barbara Blair.
Yeah, I was raising my hand because I wanted to mention Barbara Blair needs to speak, and I wanted to say something after you, Joe.
Yeah.
Actually, maybe while Barbara Blair is coming over, I just wanted to say that listening to all of the attendees speak and the rest of and listening to all the committee members, but really just listening to the public, I want to add that I'm not concerned about the kiosk attracting more drug users, but it appears to be an ineffective solution to have one kiosk there. And I'm thinking about, like, the person who spoke, who I thought gave practical solutions, was actually Katie Savage. And it sounded like, and I was going to mention it to you, Richard, like, I don't know why the conversation isn't really about providing syringe containers to individuals, like how that can become.
Or other organizations that you can partner with to actually help this process, you know.
Or thinking about disposable containers, the way we see litter baskets, or money, or more money for DOS to collect the syringes. I just think there's better solutions for the syringes that we're seeing. Anyway.
If I may, really quickly, I'm not suggesting just a single location. So we are doing that with a lot of organizations. We provide, to Katie's point, if she ever needs any more disposal packs, come to us. You'll get them free of charge. You don't have to order anything. We're just looking for all avenues, including kiosks. So if we go out to spaces and give people handheld containers so they're not disposing them, we'll do that as well. So we're just looking for as many solutions as possible to try to prevent this scourge of syringes.
That is very helpful to know you're open to multiple solutions here.
Yeah,
Barbara
that
Blair
is.
from the Garment Center.
Thank you, Barbara.
Hi, thank you for giving me a moment to speak, Joe and Maria. Richard is indeed right. We have worked with Housing Works in terms of picking up needles in the garment district. One of the reasons is because I had huge concerns about our workforce picking them up because they could be contaminated, they're dangerous. And so they provided us with a receptacle that we can have on our garbage bins as we go around and the gloves to use those materials for safe disposal. My concern is, and we would object to kiosks in the neighborhood for safe disposal of needles or for distribution of needles. The garment district, as you well know, has become a hub. And I think Tom, whose name is not Tom because it was a woman, and Anne both alluded to this. We have such a concentration of social services in the garment district now, methadone clinics, supportive housing, homeless housing, needle exchanges, Suboxone distribution points, that what's happened is we have become the magnet for drug users instead of, and then of course we have the 2 transportation hubs that bring in a transient population. And so what's happened is if these were in neighborhoods where you have users, that's the neighborhood that they're from, but we have created with the social service entities, a district which is known for selling drugs, providing drugs, and enabling the use of drugs in every possible way. And what I would say is we all want people to be safe and not kill themselves with drugs. But where are the disincentives for using drugs? I'm not talking about incarceration. Where are the disincentives? Where is the really good therapeutic, processes instead of enabling the use of drugs in every possible way? Free needles, needle exchanges, needle distribution, methadone, everything. And what I would, just one final thing, when I was growing up, I was told that drugs were really bad and you shouldn't do drugs. And if you did, that was naughty. And it seems to me that we're creating an environment where it's just another way of being in our society. And I'm troubled by that, but I would never presume to know the answer to that. Thank you.
Thank you very much, Barbara. Dolores?
So I'd like to make a proposal here because what I'm hearing is very consistent, primarily from the community, not as much from the committee. But I'd like to make a proposal to thank Housing Works for the presentation, but to strongly encourage that they use other levers than the kiosk. Because right now, the kiosk itself feels to a lot of community members that have had to deal with these issues and continue to deal with the issues in that particular neighborhood as advertising. Whether or not it is used properly or not, I don't think that should be up for debate. But I really think that we should propose asking Housing Works to use some of those other methods that they use, working with the social service providers, the education, et cetera. But the kiosk in that location seems to be, from what I'm hearing from the community, inappropriate place at an inappropriate time as we're still dealing with the changes that have occurred because of the choices made by the last administration during the pandemic.
I also want to note that the partnerships, the idea of helping other organizations with sharps containers and people like the Litter Legion, that really is helpful, Richard, because that extends the work that is homegrown to deal with a problem, a subset of a problem that is really hard to manage. So we can work with Jesse on that and you to help those organizations connect with you. I think that's this overall thing. Katie?
Just in response to what Dolores just suggested, I think it would be important that, again, we thank Housing Works and acknowledge that obviously we didn't have time this evening to get into all of the data, and I'm sure there's lots of data that shows that these kinds of kiosk disposals don't attract drugs and in fact are used and help in many ways. I think the focus should be, if we are going to write something, is to thank Housing Works and to say that at this time, we're not encouraging a kiosk in our neighborhood. but that we really appreciate the information that you work with other forms, and distributing these things and that we, support that. But I think it's important that we not discourage Housing Works from doing disposal kiosks in other places or say anything frankly negative about disposal kiosks. We just say that we don't need it. We've chosen not to do it in this neighborhood at this time. That's all.
But I think we should also note that we're encouraging them to work with other organizations, other
He said
alternative
he did that already. And I think we should say that we
Right.
think it's great that they do and that we support that. Yep.
Katie, you actually
Jake-
just said what I was saying, but you said it much nicer. So thank you.
JD, do you have anything new to add before we go to a motion to support the letter?
I do. Yes, I do. I want to, I think Katie raises a good point, and Dolores, but I want to add one more thing. We are not a narco district, and there is a feeling that that is what we are being perceived as.
Yeah.
Last month, I believe it was, we had somebody come to talk about providing
A safe injection.
for people to shoot up. This
Safe
month,
injection site.
coming to dispose of their needles, although it is illegal apparently to be shooting up. I am concerned that this neighborhood, I want to echo what one of our residents expressed. We should not be seen as a narco district, and I'm concerned about that. So I just want to say that.
Is there a motion on the proposal by Dolores and Katie?
Well, I'm making that as a motion, Joe.
Okay.
Just
Is
to
there-
be clear, just to be clear, before we make that motion, Joe, I just want to say what I have and see if that's okay, because I was taking notes from Katie and Dolores' suggestions. What I would want to include in the letter is thank Housing Works for the presentation and that we support other, I'm a little unclear, but I wrote support other initiatives and to reject the kiosk at this location and open to hearing other solutions.
I think we support initiatives and to partner with other organizations in our district for safe needle disposal. And we are not supportive of a kiosk at this location or other locations in our district at this time. That's all.
Do we really want, being frank, I don't think it's about this time. I think it's not having a kiosk at this location based on what I'm hearing. I'm not,
So Maria,
am I misunderstanding something?
So Maria, the only reason why I'm being specific about time, there may be a point in time in the future
Right.
where people will want kiosks next to garbage cans in every neighborhood, right? So it's not necessarily encouraging, but it's at least allowing a place for anyone who uses needles, whether it's for drugs or whether it's for medicine, to have a place that they could safely deposit. So I just didn't want to
Foreclose anything.
say forever, because the idea of having a safe place to put your needles is a great idea. I just think right now, this specific place at this time with the scars of the neighborhood is why I wanted to point that out.
And didn't we want to have a little more information and background and statistics before we?
I really want to caution everybody, though, that our committee is not a study group. They can submit something, but we don't have the ability to evaluate, go through this thing. Our role is to give the community response and impression to all kinds of proposals. It helps us to a degree, but it does not really solve the problem. So I think we've heard from the committee. Roberta, do you have anything on the motion at hand to speak to?
Just to add a little bit, just to build upon what Katie said, I think we can step back and say we do not have the expertise to recommend a kiosk, but that we encourage partnering with organizations that do have that expertise. So the Litter Legion, et cetera, et cetera.
Right.
That might be another way to frame that.
I think we can work through
Might
this.
be another way to frame it, yeah.
And I'm going to note that it'll be Katie and Dolores working on this letter. Is that correct?
Well, I was almost hearing that Roberta sounds like she's ready to writing letters, because I like that phrasing, Roberta. If you wanted to cut your teeth on writing some letters.
Help if needed.
So I would ask Katie to be the lead again and then pull this together so we can get this to the next week. So all those in favor of the current letter, will you raise your hand? All those opposed? All those present not eligible? Carries. Moving on to our next item.
Which is the proposed inclusionary housing application guidelines.
Yes, and I have that, and I'm going to share it on the screen. For the members, We have seen this now. This is our third month in a row. And you will note as I go through it, the changes that were made in red. We did it with track changes. We picked up all the comments from our last meeting. This is our last go at it, so take a careful look. All this is basic information from the applicant. And now we just clarified, this is Betty's thought to make sure it's clear that it's affordable market rate or mixed affordable and market rate. We have lots of different kinds of housing that comes to us. We noted on this page, lines 20 and 21, voluntary inclusionary housing mandatory or affordable in New York, the current programs we review, and listing the types of units in each one. So we get rid of that. Remember that whole confusion we had on the 10th Avenue and 41st Street building? So now that'll clear this up. Everything stays the same here on this page. This, of course, the income tiers will change every year. Roberta, the 2022 are not out yet at all, right? That won't happen for a couple months.
I believe so, but I'll take a look and I'll let you know.
If you could just check, because then we can incorporate that in this version going out. We just note where the area median income comes, and we do a link to HPD. The next page has the list of the various income tiers and the apartment sizes. This has not changed. The income tiers, and then by apartment size, so we can have a full picture of how many studios at all the different income bands. Apartment rents, again, from the 2021 information. The proposed rents, which everyone remembers, can be lower than the highest rents from HPD. HPD frequently will require rents possibly to be a lower band, lower amount, so there's a more range of affordability. Betty had us add in anything about tenant relocation, if there is any, what is it? And I amended that to read, attach a relocation plan as Appendix E, so we see it in full and understand it. An appendix for the mobility and hearing impaired units. Then for the distribution of affordable units, we've asked for stacking chart color-coded by market, rate, and AMI bands using different colors so we can clearly see which AMI bands are where. And that's an appendix. Then apartment finishes, this, for everybody remembers, is our big change from our last meeting, that our policy ensures no discrimination exists against affordable housing tenants by providing identical apartment finishes, fixtures, and appliances between market rate and affordable units. Does anyone have any comments on the wording of that? Because we spent some time on our last meeting. Does that work? Can I get a nod if it is? Yeah?
Yes, it works.
Okay, good. Going down to tenant amenities, that we made one important change, that there should be, everything should be no fee except for gym, health club, or pool. If there is a gym, health club, or pool use, percentage discounts based upon the affordable units sliding scale of the AMI band. And we made it very clear, all outdoor space is with no fee, period. Is that everyone's recollection on our change? Yes? Okay. Then we have the next section listing the amenities. We added in the children's center or the playroom. We had forgotten that. That was Betty. Thank you.
Joe, can I ask a question now or later?
Yeah, no. We're doing section by section.
Oh, quick question. What was the reasoning you said before about everything outside has no fee except like the gym, the pool? Why did you say that again? Can you remind me?
No. Amenities except for gym, health club, or pool, no fee.
Oh, that's what it was.
But any outdoor space, no fee. The idea of separating people by a fee for outdoor space is just incredibly rude.
And we mentioned a discount with the amenities, right?
Yes.
Okay.
Then we have event room or community room. If there's one-time events, meaning like a children's birthday party or an anniversary or something, we want to know what the percent discount is, because that would not be part of any sort of fee joining a pool or a gym. There might be a room and there's a specific fee.
I just wanted to note on that, this is so not that important, but just
please say it.
Just that sometimes it might be that there's a outdoor space that you can also rent to have exclusive access for your birthday, for your whatever. And so at that point, then it might there might be a fee, but it would only be for like exclusive access for a set period of time. So like,
Right.
I really don't think that's that notable, but I just wanted to mention.
Right, but it's directly opposite of what we talked about. We said no fee for any outdoor space. So if we're going to change our position, we have to change it clearly.
Well, but it's really more consistent with the second piece, which is around the rental, which is that sometimes you might rent out like they may choose to rent out just like they might rent out the library.
So-
I don't know, the whatever.
Right. So
I think
let's say you
disconnect-
rent the library. I think no one should be charged to use outdoor space in the building you live in.
But if it's exclusive access, meaning you're renting it for 2 hours so you can have access, and you're saying you should never make it so that people cannot access outdoor space.
Right. So let's say you rent a community room or a library, right? And you're doing that for a party for a couple of hours. That's
Yeah.
adjacent to an outdoor space. You should use the outdoor space not at the exclusion of other tenants in the building. That's the issue. And it can very quickly be that somebody who's a market rate tenant rents the community room and the outdoor space is closed because it's part of a rental and no one can bring their children there. Think about that scenario. Katie has a question and then I'll go back to Jessica.
Actually, it's sort of about this same issue that Jessica's just raised. I mean, for example, in the building I live in, there is no community room or anything, but there is a rooftop that's accessible by the tenants. And sometimes, I actually don't even know what the rules are right now, but I think it can be used for 2 hours if somebody's doing something special, part of the rooftop. And I guess the way this is written, it says that our building couldn't do that anymore, right? That because our outdoor rooftop is outdoor space, that then it could never be rented out again for a birthday party or something.
Right.
And is that what we want to do? I'm not sure.
Are you in a mixed income building, Katie?
I'll be honest with you, I don't even know.
Okay.
So, but I'm just
think-
wondering, like, I have to imagine that my building may be similar to other buildings. And I'm just wondering, is that the kind of thing that we want to preclude? That's all.
What I want to caution everybody in this discussion is remember these buildings are owned by for-profit entities. They will seek means and methods to exclude affordable housing tenants if we're not dead clear. Just keep that in mind as we're discussing it. Next person up is Travis, followed by Betty.
No, I think, Joe, you just clarified my concern there was the fact that is the concern that we're trying to safeguard these for-profit entities from trying to create extended barriers. And I think everything we've done thus far has written that out. And if we change that outside usage language, that then becomes a situation where we can preclude, the entity can preclude the lower income residents continuously from using the outdoor space. So I think the language should stay as is.
Betty, followed by Hector.
Two things. I think that those parts of the form, which I love this form, should, that they change from year or every 2 years, the numbers. Maybe there should be an asterisk on those charts saying this will be updated, because some developers may get this form and then use it over and over again and never use the updated data, or the income or AMI or whatever it is that needs to be updated. Do you get what I mean?
Yes.
So maybe we should put an asterisk somewhere
Got it.
for that. And this is probably a really marginal question. All of this is going forward. In other words, if the building where my daughter has her affordable apartment would violate these rules, it's not, there's no look back, right?
Betty, we have our leverage when we approve a project. If it has already been approved, we have no leverage.
Okay.
Hector, followed by Josephine.
Yeah, great form. loved all the work that's been put into it. I have a question concerning the amenities like the pool or gym. I do realize that you said that no, I mean, for a small fee, it would be accessible to middle or lower income, according to their AMIs. But my question is, what if it's included already in the rents of market value tenants? Would it be fair to say that that should also be included in the lower income bands as well? Or, I mean,
Well,
you kind of, you know, you're charging a fee for the lower bands, but it's included with the rental with the market rent, right?
No,
You know what I'm saying?
in normal, in practice, Hector, any projects that have come to us, it's a
Mhm.
separate fee for those tenants also. And our concern is that we wanted a sliding scale to make the fee affordable for the moderate and lower income tenants.
Right. My concern is that there will be a little loophole where a new tenant comes in, he's paying market rate and say, hey, he wants access to the gym and the pool, and they somehow finagle it into it's included with the rent while
We
lower.
really haven't seen that at all.
Okay.
It's all been you like join some kind of like club thing separately.
Gotcha. Oh, gotcha. Thanks.
Josephine and then Dolores.
I just wanted to say that I'm fine with the language on the outdoor space having no fee. I think that doesn't stop the building from saying that people could make a reservation if they want to use it for 2 hours. That's what they do in my building. There's no fee, but if you want to reserve the space, you can, and everybody's fine with that. So I think it's fine.
Yeah, I would just note that for Clinton Housing, we charge a fee for a community room, but when it's outdoor space, people can also use it. So it's never exclusive to the family or party having an event. Dolores?
So I'm a little concerned about our conversation, only that this is a checklist. And what we are stating in this checklist is what we as a community want to ensure that when somebody is bringing a project forward, that they understand what our priorities are for our community. But it is a checklist. There will be situations where the design of the building or the layout of the building or the programming of the building may be very unique and doesn't follow through to all of these specific points. So I think we're really being very nitpicky about potential situations, but I think the spirit of what we put down, meaning that we are trying to ensure, as Travis had put it, that there is no room for creating an inequality in these types of buildings. And I think that this checklist is brilliant, and it does that. And I think that if we have a project that doesn't quite fall into that, that's the conversation for when they come to this community board.
JD? JD?
You're on mute.
Oh,
Sorry, I agree with Josephine about no fee. I think that's a good solution. I cannot move this chart around. So when we go back to the AMIs, Joe, what about in between AMIs? Is that covered somewhere?
well, normally, JD.
Or we bring it up later? Is that the idea?
Well, normally we say what the AMIs are, and then the proposal HPD, as part of their information they present, give the range of the AMIs. So it's not like it's 30, 40, 50. It'll be 6% AMI affordable to 55%, 56% or something like that. And we get that information.
Gotcha.
So let me continue to page down.
Quick question, Joe. Just want to confirm something.
Yes, Maria.
The AMIs are set federally and
Yes,
they
this
change
is
annually.
Yes, yes. And they go up and down depending upon how incomes go up or down in our statistical metropolitan area, which is Westchester and Long Island and our city.
Okay, thanks.
So, sorry, question? So marketing materials, we asked that contact board for district manager receive the list of most recent community organizations. Jesse preferred it that way because that list is always changing. So we can therefore easily link it and have the information go out to the full community. Sustainability, we said, put the sustainability features in an appendix. We can see it very carefully. We've talked about streetscape and ground floor lighting and ground floor design, perimeter lighting, and street tree plan. So we see it up front and drop it in the Dropbox link. So we see it in advance. And then we've added this information about trash and storage and removal and made it very clear, we want a floor and site plan showing the interior space for trash storage and removal. Is there a plan for public art? We put that, and then we have the owner sign saying everything they've submitted is true and correct. And the rest of the items are appendices that they actually fill out all the information. When we finally approve this will be converted to a fillable PDF form and kept on the board's website. So the issue about whether we're keeping the current AMIs up to date, that'll be something the board office will do once a year to update the AMIs. I'll stop the share and if there are any further questions or thoughts on the form. Yeah, I really want to say thank the committee and everybody. We've really worked seriously on this to get something comprehensive. And Roberta, sorry.
I'm just being a little annoying. Just a flag.
Oh, please.
Just a flag for the office that there will likely be a new state tax credit program. We may want to account for that in the form if and likely when that passes.
Yeah, what I want to say is we should always remember to the committee members and the public, forms like this are a living document. They're going to have to be looked at once a year to check that everything's up to date. And even the names of the programs are going to change. So before we actually bring this to a vote, I see two members of the public, I believe, wanting to speak on this. Oh no, Jessica. Jade?
Yeah, just thank you. Just quickly, I looked back at the PowerPoint that you had prepared at the beginning of this discussion, which noted like what the expectations of the service provider are, which are to contact the district manager to arrange a briefing. There were also things that the city should do. When we post this on the website, do we want to make sure that those things are reiterated if they are not in this specific document?
Yeah, I think there's like a whole like this is the checklist. Isn't there like a whole cover letter we already approved that has that in it, or am I wrong? There was like a whole explanation.
I don't recall that we've done that, but again,
it's been a number of months, right?
We've spoken of it.
Let me take the note, Jessica, because I believe we already approved the text of that letter, and then
I believe we have. I remember the letter, and I suggested the letter was one document and the checklist was a second document.
And now we're going to make it all one document in the end, so people can read it all the way through and not be confused about it. But Jessica, go back again to your specific issue about the notice or something you were talking about.
Sorry, say that last part.
I didn't quite understand. You said the board.
Just you had presented on a PowerPoint. It was the PowerPoint that ended with the case examples of what worked and what didn't. And the first two slides of that PowerPoint start with like, as a provider, the city should contact providers to consider an opportunity. And then similarly, providers should contact the board office.
That was social services. This is the housing development stuff. We haven't talked about that one yet.
Okay. Well, I guess whatever that process is of wanting people to come to us before it's too late.
Got it.
Now
I get it.
Okay.
Got it. Yes. It's really the notification early process, so we know the hell's going on, right? There's one member of the public, and that's a phone number ending in 637. Can you bring them over?
And press *6 to unmute.
Press *6 to unmute.
Can everyone hear me?
Yes, please identify yourself.
Good evening. My name is Yadira Jimenez, and I actually live at the Silver Towers. And I more so want to say thank you so much for coming up with this checklist for Inclusionary. I am actually an Inclusionary tenant for the past 13 years, and we have been excluded and segregated for all these years. As a tenant association leader, we've been able to fight for some major changes to allow us to access the gym and include us on events. But this checklist for new developers is going to be incredible for the tenants. So I just want to say thank you for putting this together.
Thank you, Dyer. And I also want to note for the broader committee that as we have a document that lives, I believe designs will change and there will be outdoor spaces that are not fee-based. Developers look carefully as to what we put out there in the public and policy. So this will go now to our February meeting. If there is a motion to approve it with the final amendments.
Motion to approve.
Is there a second? Second by JD.
Can I second things? I don't remember.
No, try not to.
Oh, okay, okay.
All those in favor, please say aye or raise your hand. Fantastic, passes unanimously, and I want to thank the committee. If we can do is half as good for the social service stuff coming up, fantastic. So Maria, that's what we're moving on to next, isn't that correct?
Yes, and Nellie's gonna share her screen so that I can take notes.
I can share the screen, I have it up already for you.
Oh, great, thank you. So Nellie, don't worry about it, Joe's got it. And similarly, we want to take some time to go over this and review it and do as good a job. So you can see first page here is the project information, owner information, application. This is the application portion. If anybody, while I'm speaking, you can just interrupt. My screen is really small. If you're raising your hand, I can't see it. Okay, committee members, just jump in. You can see the first page.
I have to
Okay.
jump in then.
All right, Betty.
Because I have notes on my copy.
Please.
The first section, maybe this is naive. Everything's fine. And then it says owner name. Now this is the owner of what?
I was getting the owner of the building, the owner of the development.
You have a provider providing the social services, and then the owner of the building.
I would think it might be useful to put owner of the building, because maybe it's
just
the owner of the provider's organization or something like that. And anyway, I know it's picky. but-
Building owner name, got it.
Okay.
Okay, that's what I'm writing, building owner. Okay.
I'm doing it right on the document, Rhea, don't worry about it. I'm doing the
Oh,
document.
great, thank you. I don't have to take notes. This is fabulous.
Don't
Thank
take
you.
notes, but
A tiny suggestion here potentially would be if the provider has a web address or a website, to ask them to include it here.
Roberta, that's great. Thank you. So if we can put that in there
yeah,
for the
I'll
owner
take
and the
notes
provider.
and then we'll clean it up properly. Got it.
Owner and provider website, yes.
Mhm.
And this is Katie. I
Yes.
think, unless I'm missing it at the moment, we don't actually say what it is they're providing. Like, we ask if they've done similar projects, but we don't.
It's later, Katie.
Katie, you're jumping the gun. Wait a minute, one page at a time.
No, I guess, I mean, I know that we go into more detail below, but I guess, all right. I just thought it would be helpful, like we're talking about the provider, just like, it should be
Like
pretty clear
like
at the
a basic-
beginning what it is we're
like
talking
a
about.
like a basic project description.
Project
Yes?
description is exactly, yeah.
Yeah.
Okay.
Okay.
I'm
That makes
thinking general notes and we'll flesh it out.
Yeah.
Thank you.
Thank
That's
you, Katie.
good. That's good, Katie. This is why I appreciate this process. You guys are coming up with great ideas that the few of us together didn't think of yet. Application, you see that area. We're looking to see if they have other projects in this district. We're also asking about some provider history. I was thinking about changing the language there, but I didn't come up with something where it says, please provide organizational program history at other locations.
I would recommend that we just say attach something or attach a link, because there's going to be a lot more information than these few lines can do.
Yes. Okay. That sounds good.
Can we be more specific though? Like,
go ahead.
So
Travis?
provide organizational program history at other locations, but I think it needs to be other locations that are like similarly situated or have a similar demographic. I just something that's more akin to where you're trying to place your services. I don't need you to tell me about something that was the perfect scenario and doesn't reflect anything that looks like Hell's Kitchen or Chelsea.
I think we need two questions here, and I want to go to Pete to raise his hand. Number one, it's general organizational history, but then organization of project history of other similar projects of this type. Is that what we're looking for?
Yes.
Right.
Yes.
Can you just clarify, you're not looking for something like mission statement or things like that? You're looking for, in this particular section, projects that they've brought to market, so to speak?
I'm going to say, Dolores, the first is the broader thing for line 18 that we're looking at, and then the specific thing to this type of project. So we want to get the full back. It may be an organization we never heard of. So we got to have some background on it.
Well, that's why I'm a little bit confused. Or if you're asking for a mission statement, right? Or you're not trying to find out about the organization, you just want to know about the projects that they are engaged in.
I think we need both because it could be an organization has never come to our board before.
Joe, could we ask something about when was the organization created and,
well,
some.
But yeah, by saying provide organizational program history, a lot of it's going to be, you can say, or a link to your webpage, because most organizations have this information on their webpage, right?
Well, wouldn't we want it something in one place we can glance at it, like, up front,
yes.
so you can see it? Yeah.
Yes. I'm going to also note, I want Pete Diaz has his hand raised. Please speak, Pete. Everyone's jumping in.
Yes. Quite often organizations, nonprofits have other organizations with a different name. An example is Urban Pathway. I think they also run alongside, what's the other group? Travelers?
No, that's another group. That's a program of Urban Pathways.
Yes, and that needs to be included, I would think, because I've had individuals in this building from Urban Pathway, and somehow they seem to be directed to go to Travelers, and I'm giving wrong information here at times. So there should be a distinction between the organizations, and then if they're sister organizations, they should be listed as in some formal fashion on this application.
Pete raises a good point. If it's just the organization name, but they do have specific programs, they should be specifying the program that they're running, proposed program they're running at that location.
I'm going to note to provide organizational chart and or program chart, so we get an idea of like how this fits into them. Does that make sense to folks?
Well, if the organizational chart might not include what Pete was thinking about as far as like subsidiaries or affiliated organizations. For instance, my nonprofit that I work at has a subsidiary that we picked up last year. You'd still be sending stuff to that subsidiary, but we're the overseeing entity. So I think his concern is when you have that subsidiary name, you don't necessarily get to the person in charge.
I'm noting provide chart of affiliated or controlled organizations to clear up that issue. And
that sounds good. Yeah.
And then
provide
Joe,
yeah, go ahead.
It's maybe the next thing should be asking, please describe the specific program. So again, we get the organizational, we understand the larger picture, but then the next thing is
and then bring it down in levels.
Describe the program proposed for this site.
So I think that should live in the very beginning. So like we talked about, that just tells us here's what it's going to be about, and then we start to get everything else. So that's the one on line number 7. Give us the program description, right? Or proposed program description, really, right?
Yes. Pete, did you have anything else to say? Because your hand is still raised.
No.
Okay. JD?
Else.
Yeah, I don't, Maria or Joe, is it permissible for us to ask their source of funding?
Oh, absolutely. No, that's coming.
That's coming. We asked about that.
Great.
That is something that is important.
All public projects, we can ask anything we want.
Hector?
Yeah, thank you, Maria. You do that part. I'll do this.
Just a quick thing on the, I'm sorry, you scrolled past it. On the portion that says application, right there. As provider manage any similar project in Community District 4, why is it specifically in this area? Wouldn't we want to know if they had similar projects throughout the city or in another state?
Because we are asking specifically about any kind of projects in our district. I mean, our purview is our district. As we ask them about these projects, we're going to say, do they have later, have they done this before? And that could be in other parts of the city, and that'll tell us.
Gotcha.
Right. So yes, we want to include other areas as well, Hector. Good question or good point. But that's already there. We should go to overview. So there, thank you. Yes, she put square footage for me. Total gross square footage. You can see what it says. Joe, quick question.
I'm going to suggest we need to heavily expand this section because this needs to be much more broad listing. Like, I mean, and I suggested to Maria, a social service plan is a standard document that is submitted for a lot of city-funded projects, and there's a standard format for this. So I'm going to ask Jesse to pull that down because I think instead of us reinventing the wheel, we just take that city form when you do a housing project or a homeless project. You have to answer so many questions that list who you're serving, how many you're serving, how many people a day, what is the nature of it. I mean, there's all these specific things, and they also have to do a staffing plan. So I think that would be something to put very much to try to subsume into this.
So do you think we're going to be asking for them to attach that, or we're going to put some of those questions right into this document?
I think hopefully we can put some of those questions into this document.
Okay. Yeah, I was just going to ask about that area. Section A, I feel like there's something missing there. Okay. Betty and then Roberta.
Would that cover, I just scribbled this down. Maybe the social service plan has it in it. The types of residents, are they mental health issues? Are they previously homeless? That kind of thing, right?
There's a whole series of like checkoff boxes that you must do to say who your clients are and the nature of your clients. Like, I mean, Roberta's shaking her head. It's like, it's a common thing now.
Yeah.
Okay.
Roberta?
One thing I'm not sure is on there would just be if there is a particular option or stated option for renewal of a lease, if there is a lease term.
Right. Actually, it's lease terms renewal and contract renewals, right?
And contract renewals. Okay, that was good. Thank you. That was good. Katie, Roberta, anything else, or can we go to Katie? Good. Katie?
I was just going to say, for clarity's sake, go back. Anyway, it just moved. Number 2 there where it says overview.
Yes.
I think that it should just be something like overview of proposed project, or just the title should be expanded.
Right.
So it's clear.
Yes, that makes it clearer.
By the way, thanks everybody for like realizing we're just starting on this one. A lot of stuff missing.
Yeah, this is our first round. This is good. Project type. That'll be part of the attached document, or those questions I think that we're going to put in here. Location and zoning. I guess I was going to ask Katie, do you still have a question? Your hand is up. No?
I lowered it.
I just, it says C, location and zoning. Is this development in the special zoning district? Could we say project? Is this project in the, I don't know, maybe it's too picky.
You can say, is this program?
Oh, okay, that's even better. Okay.
Yeah. Okay. Yeah, in my mind it was development, but I guess either one is fine, whatever's clear.
Could be an existing building.
Yes.
Is this question relevant regardless if there's a proposed zoning change, either change in use or like change in the built environments of construction?
Right. I think we might want to also, I get what you're getting at. It's first of all, just locating, there might be certain special restrictions we need to know about. So that's why it goes to this. But I think, Roberta, we should ask, does it require any zoning action? Something like that, right?
That's better.
Oh, yes. Are you saying, Joe, we're adding that question? We're not replacing? Okay. Okay, that's good.
And again, that's just a shorthand right now, folks. We'll build that out properly.
Okay.
Anything else, Roberta, on that?
All right, density within facility and density within neighborhood. That was not really, I don't remember that language there before, and that one's a little unclear to me.
Yeah, this is not, yeah, I think this needs to be broken up specifically. We have to know what's going on in the facility, but I think we should put on the applicant, let them come also and map all the facilities around their proposed location. so we can see this in context. Does that make sense to people?
Oh,
And
yes.
I was thinking that you would have on this list, name, location, type of facility, number of residents or clients.
Yeah.
Betty, you're suggesting that, the density within the facility, though, that information.
Well, I would say what other facilities or residences with social services are within a 2-block radius of the site. And then the little list would have name, location, type, number of residents.
I'm writing Betty's language, and she'll shoot that to us to incorporate.
Yeah, so she's basically saying what it says below, but just more detailed.
Right.
Okay.
Is it realistic to expect somebody who's thinking about opening a program to be able to provide detailed information about other programs?
No.
I think
this is not about. This is just about where they're located and what they are. That's all.
Oh, I thought you were saying that you wanted detailed information about other social service programs within a 2-block radius.
Well, detailed information is what are they? What are they serving? Yes, I think it's totally appropriate for a provider to know what the hell's around them.
But Jesse could provide that on the website as well, right?
Yeah, but I think, listen.
Katie, I don't think it's inappropriate to ask that. I think that's an okay
I
question.
agree.
I'm a nonprofit provider. I provide supportive housing. You know how it works, Katie. Nonprofits collaborate with nonprofits all the time. If I'm a supportive housing site in this district, I probably know other EDs and other nonprofits in this district that have supportive housing, right? Because
you probably do know some, but I just don't know if you know all of them within every.
It's also
2-block
good
radius.
for collaboration and networking.
So
I can only see benefits out of it.
I also want to say it's your responsibility as a responsible provider to know what's around you, to understand how you fit into the context, how your proposed program fits into the context of the neighborhood. We should not take on this responsibility. That is the not-for-profit's due diligence that they should normally do when they're responsible.
I mean, it's probably some intern doing it.
Yeah, I really feel strongly about this. This is the kind of thing.
Hasn't Savannah already made a map?
Yeah, this is what I'm referring to. That's what I was concerned about.
Yeah,
There already is something in
know.
existence.
Yeah, so let them.
But they have to take it from Savannah's map and list, and they put it in the context of their 2-block radius.
For my colleagues on this committee, when I apply for various programs and grants and funding, I am required to fill out so much information down to the subway stations and the schools and everything around in order to qualify for these funding programs. This is not a new idea for not-for-profits.
So Joe, this is the kind of information you've been asked to provide before? You've been asked to provide about other providers in a 2-block radius?
Oh my, more than that, I have to give school population. I mean, the kind of stuff, when I do a tax credit application for low-income housing tax credits, there is literally pages of just neighborhood resources that I have to complete. But the thing about it is, a lot of these other social service agencies necessarily don't want to look at it, because if you look at it, you may say, I should maybe not locate my service at this location. We need to get people thinking about a broader context, not just themselves.
Yeah, I'm just wondering about what information is available publicly, right? Like I know that obviously you can find all the school information that's available publicly and MTA stops. I think right? I don't think you can know if there's like a domestic violence shelter a block away. Like that's not publicly available.
You can know if there's shelters. Hector, then Roberta, and then Jessica.
Yeah, I just wanted to ask if any thought was given to getting information if they could provide remote supportive services, like, via Zoom or doing appointments, because in this day and age, that would be very valuable.
I think, we're going to ask them whatever their program is, and they have to really describe it, Hector, because we're not going to know that necessarily. Roberta?
So I was kind of interested in Katie's question and wondering that whether, asking the question is, it's not necessarily what I would recommend, but if there are recommended resources, if we could suggest them for trying to find this information. My one concern would be that providers may fail at locating certain sites or fail to obtain certain information. So any resources we can recommend to help them in figuring that out, I think would be very helpful.
Got it. Other questions in this section?
This is
Joe, I
Jessica.
have
I
one.
was just gonna, oh, sorry, go ahead.
Joe?
Yeah.
Yeah, sorry, I look on the screen, I can't find out where to raise my hand. I'm just wondering, is there any downside to our giving them our long listing of what is already in the zone or in the area?
We can provide our links from the community board's website. That makes
Right.
perfect
Well,
sense.
I want to say, I fully endorse your idea of getting people in the habit of looking at how many of the things there are here already. Last time I checked, we were the third most densely populated in terms of shelters, et cetera, drug rehab, out of all the community boards. It sort of takes it would seem to me that it might take the edge off of some of the NIMBY stuff that floats around whenever stuff like this comes up. And I love the idea of getting folks used to the idea. You've got to go and, here's the list as of, December 31st of last year. Since then, if you find there are more, please bring them to our attention. I don't know, a nice way of trying to equip them with the information they may not be really motivated to get until we bring it to their attention.
I just want to note again for my colleagues, these are mostly well-funded not-for-profits. They have
Yes.
serious staffs who know how to do this kind of work. This is not some sort of onerous requirement. They fill out applications and RFPs
All
every
the
single
time.
month.
Yes. I apologize. My internet dropped. I was gone from the meeting for a minute, but I don't know what Paul was saying, but I see Jessica's hand is up.
Thank you. I was just going to add, and I also work for a nonprofit. I think this is a reasonable question to ask, and I do think people's suggestions are good. I would just remind people what Dolores said earlier, that this is, as I understand it, this is just a checklist. So this is not an application. This is a guiding form. And so this is to engage, have them be clear on the kinds of questions we're going to ask and the things we're thinking about. But this is not like they don't complete it. They're still, this is just a checklist.
Right. Right. It's not as if doing this is not going to get you funded. It may get your opposition, but we'll see. Next item is staffing. Questions about this section, Jay? Things to add on, obviously.
Joe, you mentioned is that there's a document that nonprofits have to provide to city agencies when they're applying for things or getting funding for things or starting a project that has to do with staffing. Are we can we pull some questions and put it here? Or should we attach something?
I again would try to embody some of those questions here so we can have it, as Leslie said, all in one location and see it at once,
Okay. And Leslie, you did mention, you asked about certifications about
Yes.
the nonprofit itself, but I thought it was more appropriate to ask that. And maybe it's more, Joe can answer or Jessica, but I thought the certification piece was good for the employees to find out who's licensed or certified in certain things.
Okay.
Joe or Jessica, I don't know if.
Yeah, there are certain requirements for certification depending upon the type of program, and we should ask that question, obviously.
Okay.
Agreed.
Gracias. Thank you.
Can I say something about the staffing section?
Nobody. You cannot. Of course you can.
Yeah, I think it would be good to have total number of employees. And then you have the thing about full-time, part-time. I think the E, which is about the supervisors, I think maybe that should be under this other part. And then I was wondering if it would be fair to say, and I'm not totally sure about this, but sometimes I think facilities have the psychiatrist that comes in on Mondays or the nurses that come in Monday, Wednesday, Friday for 4 hours. Maybe there's some way you can work in this other professionals that come in part-time.
Yes, thank you so much, Betty. Actually, I did think of that, and that's a better way to frame it.
Visiting
In my
staff
mind,
and
they were
consultants.
part-time. In my mind, they were part-time, but you're right. Visiting staff and consultants, that's
Right.
perfect.
Yeah.
Perfect. Number of part-time employees. Oh, Joe, you were gonna say something?
No, it was JD who's next.
Oh, sorry, JD.
I would ask Jessica about this, maybe Maria or Joe. The security staff, is it inappropriate to ask what they're, to fill that out a little? Is it in-house or is it hired?
Oh, no, we should definitely ask that question. Sure.
I thought I did. I did put that in there. I don't
No,
know where it
but-
is right now.
No, but it is, Maria, that some organizations hire their own security staff, others hire services for security. So that's-
Right, it's there. It says it number 74, line 74.
Oh, I see, in-house vendor, got it.
Yeah.
Okay.
But should they explain more about the vendor if it's a vendor?
The what?
Should they explain more about the vendor? Like, should they be, if they check vendor, should they be more logistics after that?
Yeah, like detailed names, because there are certain vendors community boards work with that are not so good.
Oh, yeah, we can put vendor details, like the name of the vendor. Usually, so when I've had many meetings with different nonprofits, we're always asking, like, is it in-house? Who's the vendor? But there's usually not more beyond that, except like, what are the parameters? If they do patrol outside or walk around outside, like how far are they walking? Is usually really around security and what they're allowed to do and not allowed to do.
Are those questions here yet, Maria, or further down?
No, related to security, no, I didn't add those. If
I'm
we wanna
just gonna
add those.
say Maria's language regarding security.
Okay.
Yeah, that was my question also about outside, how far they go. So thank you, Maria. It's important.
Okay. Yeah, that is important. I should have added that. Yes.
Anything else in this section? Okay, now we're going down to project schedule. And this says demolition. I think that it's not necessarily demolition that we're going to see here. I think I'm just going to highlight this to get this was more for the inclusionary stuff.
Okay.
Well, could you say there's two kinds of creatures here? There's an existing building where you put your staff in, and then there's like a new building that's being created. You know, there should be some kind of just,
Yep. New construction or renovation, right?
Something about the physical facility. You could figure that out. Right?
But Joe, in terms of some of the events that we've experienced in the past where a building has been taken over and services have been brought into an existing SRO, which creates some issues.
Right. So what I really want to note here is that it's new construction and renovation. And I think we need to pick up that same language, by the way. I don't know where it's going to go, that Betty put in regarding relocation in the inclusionary. Like, is there any relocation? So we'll note that, get that same information. Because there could be, like Leslie says, current tenants and affecting them.
And don't we also just want to
That's
know,
good.
like, when do they expect to start being able to provide services? Like sort of intended start date or something?
Yeah, that's a good question.
Well, I think part of this is, so this is more about the problem here. This is more like the project. I think we need the program, right, Katie? That's what we're talking about. Like program stuff, right? Program
Thank
dates,
you.
I'm gonna just say now, right?
Yes, that sounds good. Perfect.
1 second. But Katie's remember what that's about. Okay, provider experience.
Katie, she does spell it Katy, Joe. I'm just saying.
Oh, geez, I'm sorry.
Go, Maria.
Okay, provider experience.
This is not what your experience is. What is your experience in serving?
Oh, okay. What is your experience in serving the target population? I just feel like I would like to, I feel like we need to change the language of that question a little bit. I'm not sure how to word it differently. Like, I just don't know how to word that differently.
Yes, I
What
agree.
do you want to
Maria.
get out of the question?
I mean,
Sorry.
they're just going to say it's been great.
Yes, yes, that's the point. I don't know
So
how
I
to-
interpreted your question differently though, because yeah.
What did you think, Travis?
Is what you just typed in, Joe? Is that Joe that's typing now? So I thought what your experience is meant to like describe the work that you've done with this target population. Like give me details and logistics.
Yeah.
So I didn't think it'll give me your general feeling about how you impacted these people or how you feel about them.
Okay. Yeah, so changing it a little bit to what Travis is saying. Okay, that sounds good. I understand now. Yes,
Maria,
describe your experience.
Quick
Yes,
question,
Leslie?
Maria. Is it fair to ask how many complaints you've had, or what kind, how do we get at that?
Yeah, that's a
Where
good
the
question.
neighborhood has complained about the particular provider. How do you
Joe,
get
would
at
it
that?
be, so
It's,
Joe,
it's not going to go here. I'm taking a note on it. It's really asked, have you had facilities, other complaints? You want to ask questions about their experience in other neighborhoods, right? That's what you're getting at, Leslie?
Yes.
Well, why wouldn't they go there, Joe? Because it says provider experience. So provide commentary on past complaints from surrounding neighborhoods or neighborhoods you've operated in.
Yeah.
And how were they
also-
resolved? And how were they
and
resolved?
How would they
and this-
resolve? Yeah.
Perfect. That was because I think that's really important. You can have complaints, right? But I think the issue is how do you solve it? How do you resolve it? How do you work in collaboration with other people to address the concerns? JD?
Yes, I think that comes into the community when we talk later about the community, but are we asking them in that describe your experience, are we asking them what are their plans for their target population? What are their hopes? For instance, if it's temporary housing, is there hope to get them into permanent housing?
That would be in the social service plan, JD.
Okay.
Very specifically detailed as to what, in a social service plan, you have to say, for example, I'm renting a shelter. Our shelter is specifically for senior citizens. It is for persons who have experienced domestic violence. And you would say, and our outcomes are, you're actually asked to describe what you want to do and what your outcomes are as part of that plan.
I gotcha. I thought this was part of what we're asking. Okay.
Well, this form on C, line 111 talks about outcomes.
Right, but it's not detailed enough at all.
One potential addition to complaints would be if there have been specific incidents in which law enforcement have become involved in the facility. That might be particularly of interest.
Well, the only thing about the law enforcement involvement is my experience has been that it becomes also about teasing out, is law enforcement present for something medical or is it something where someone's violating like the law? That's the only thing. So I think we just have to fix the language or address that a little bit more, tease it out a little bit more.
This is Dolores. I'm wondering if we could change that entirely into just asking for a description of community engagement and please provide examples of positive and negative situations and how resolved. Because I think saying complaints in neighborhood, it doesn't give the full picture.
But Dolores, the only thing is we use the language community engagement a little bit further below and asking how, but maybe you're right. Maybe we should use that language, but because we use community engagement later on in the form, but to ask how they engaged this community about their facility. I don't know.
The reason why I say that is our experience at 52nd Street, where complaints are coming from folks across the street for various reasons, may not necessarily be related to an actual problem of the provider, and then also the situation of also at that location where you have the actual tenants themselves, the shelter residents, who may not have good coping skills for conflict. So they're the ones that are calling 911 when it isn't really a 911 situation. So I just think that if we allow for that applicant to give a little bit more description of overall how they self-report on their community engagement, both positive and negative, that can be teased out in further detail at a meeting.
Okay, that sounds good.
And using whatever description they give as a starting point, say, in your application, you indicated that you created these programs that works with your community on this. And then you indicated when you had a problem here, blah, blah, blah. And then that could be teased out. I mean, again,
I like that suggestion.
Yeah, just a thought.
Yeah, thank you. We scrolled down to provider services. I don't know if it should be titled provider services, but
well, again, don't remember the title so much as, let's just get the substance we're trying to get to.
Yeah.
This is our first go, obviously, folks. So that's why it's going to take 3 months.
So instead of this, it sort of, would it make more sense? Joe, normally, I can't think right now, except when it comes to housing. But when it's other kinds of things like shelters, and I can't think of one right now. Oh, okay. So like care for the homeless, Dolores, you were really involved with that, like right before they came in. Did you get a floor plan of what the space was going to look like?
Absolutely.
Okay. So maybe we need, if we could get.
Well, I think, we're going to ask for that stuff. That's going to be asked. I'm going to try to conform some of this with the inclusionary stuff where there's things that are the same,
Okay.
Okay. I think JD is next.
Yeah, I'm sorry.
And then Roberta, yeah.
Also in this area about if there are laundry services or food delivery services, is there a section for that? How they're going to manage that? How many deliveries would they have?
Oh, that's great.
Something like that.
Yeah, that's useful. Because I know that's been an issue before in the community.
Who's next?
Roberta.
These may be overkill, but 2 places I'd be interested in inquiring would be on wireless internet or some on-site internet facilities. I've heard this noted specifically with seeking employment, that they have to go to other sites, they have to go to a library.
That was good, Roberta. Thank you. Yes.
And then the other would be, because it sounds like it's been a problem and it's rarely standard in most facilities, to my understanding, would be air conditioning. As we have hotter summers, people may be incentivized to go outside. We would want to encourage providers, if possible, to provide
HVAC. Yes.
I think these 2 things are going to go in a different section that talks about the building services as opposed to the actual social services.
Yes.
And we'll list them there. Right.
Betty?
It's all right. We keep on doing it. This is good.
On line 119, please describe if there are.
Betty, the line numbers are different. Look on the screen, otherwise I can't find it.
I thought you were going to tell me I was not unmuted. Please describe if there are any significant needs at this location. What do we
you have to tell Betty, what section are we in? Because I'm on provider services.
It's before provider services.
Got it. Understood. I don't know what that means, Betty.
Oh, okay. So just put a question mark there.
I'm going to do this even better.
And then would it be relevant in provider services? Like areas where you can gather and have meetings or conferences or something?
Again, this is going to be less provider services and more building services. So meeting rooms.
So do we
I
have?
thought we asked that.
Do we have building services? And
what does that mean?
All I was thinking of is that some of the places where people had temporary shelter, they had nowhere they could get together, like a lounge or something.
Yeah.
Oh,
Seemed
okay.
really important. There was nowhere they could just go, or they could just play cards together or something.
So Joe did just add meeting rooms, lounges, outdoor space. Those things are important. Yeah. Thank you, Betty, for adding that. Additional description about services provided on site, additional descriptions about services provided virtually, which I think is definitely relevant for right now. Is there, on-site assistance with vocational training planned? and the other things that are similar, educational, vocational, training, recreation. Is there, oh, that's where it was. I knew it was there somewhere. Are there
Yeah, but
recreational
I
spaces?
think we'll make that a whole section, Maria, you know?
Yes, I agree. We could probably, oh, well, I was gonna say delete that, but yeah. Describe your COVID protocols. And then here's the community engagement part.
JD has his hand raised.
Oh, sorry. I'm so sorry. I'm focused on this document, JD.
That's okay, Maria. There was also, can we ask if they are going to be using the services of other social facilities in the area? They do, like Fountain House will have hundreds of members, and they will, or other folks will go to Fountain House. So there's an interplay between the social service agencies frequently. Can we ask them if they will be using other services?
I think we should ask about collaboration with other organizations in the district, right?
Great.
That's a great question.
Okay. I would hope they would all say yes.
No, they may
And
not.
with who? I know, that's my thought, is that that will not be the case. So like my fear would be like, hey, we're a social services agency coming into the community, but they don't know like that Ryan Chelsea Clinton is like 3 blocks away, and they can, you know, there's some of their population can be served there.
Now we're on to community engagement.
Community notification. Community notification. Describe the methods to engage the community, address concerns. That might be a lot for one question. Have you worked with CB4 and other community boards, and how have you responded to requests in the past? Are you willing to meet as a CAB?
I think that's a just great, good sentence. I would work on it a little to make it also meeting with the local block associations and stuff like that. And I am a little concerned about just meeting. As you remember, Douglas listed all their meetings, and they said, "Oh, we met with Brad. We met with this."
No, that was Housing Works, not Douglaston.
Oh, well, no, it was. Anyway, great stuff.
Okay, going down to
how and when would you notify CB4 and community regarding issues or concerns with clients which could or did impact the neighborhood? Sometimes that has happened where I see that agencies are not addressing it at all, things that probably should have been. I don't know if anybody wants to add anything or suggest anything. Community 24-hour community contact number. An email address. That's something sometimes that has come up after having a CAD meeting where it wasn't thought of beforehand. So I know that that'll be important. And
maybe D, it says blah, 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 number, email for community residents. You could say, and businesses, or, you know, not, you're talking about the people who live in say Hell's Kitchen, Chelsea.
Yeah, who live like on the block in the vicinity.
It could be the stores, the local stores.
Oh, I see. That's a good idea. Maybe we should write that in there too.
Businesses or something.
The businesses, local businesses.
Yeah, I'm just gonna write store owners now for shorthand.
Thank you.
So
thanks, Betty.
Anything else on this first go, which we spent a good time on? I think we have a lot more to do, right? But
yes,
how do people? Oh, JD.
Yeah, it's really good. Good work, Maria, Joe. Yeah, good.
Yeah, it was actually like a little group of us that actually really threw our ideas in there. Savannah helped a lot. So thank you so much to everyone, including Sabrina, who's not here tonight, who helped out with this.
Roberta has her hand up.
Just one last piece, and I wasn't really sure where this would fit in, but if there are eligibility or intake criteria that might be of interest to members of the community, maybe if they're seeking services or they have people they know who are seeking services, to have that information clearly stated so that we're aware of what is available to the community.
Right. It could be a health facility or something.
Yeah,
right.
Like Cayenne Lord or something like
Right, exactly.
publicize the services if they're available. But we don't know if they're eligible, if people in the community are eligible, or if they have to go through a particular intake citywide. So just
That's a really good point. Thanks, Roberta. Thank you. Dolores?
So since we already noted that these applicants already have to provide very detailed application responses to HPD, I think it would be really
Or DHS.
or DHS. I think it'd be really helpful once we get those documents is that's sent out, because again, like you said, not reinventing the wheel. It's very possible that they've already created almost everything that we're looking for in terms of the sections and the type of questioning. And all we really would want to do is insert those items that we are pointing out that are very specific to our community concerns.
Right. Like it might just be a whole different kind of feel or something, you know. So I think for a first go around, we've done really good on this. I mean, really good on this. So we'll return next month, do some reorganization of the document and pull it more together. In the meantime, we'll have Jesse secure the social service plan type questionnaires, send them out to, and put this all into one document and have a second go at it at our next meeting. But really good. I think this is going to also get rid of a lot of confusion when we have a social service organization coming, so they can answer very specific things to us. We understand what it is they're proposing and how they're going to deliver.
Yeah. Thank you, everyone. Thank you, Joe, for doing that.
So Maria, our next updates, can you give us those?
The updates, the first thing is the 771 9th Avenue proposed drop-in center at the old Janovic paint store. So that's on 52nd, between 51st and 52nd, closer to 52nd on 9th. I have no update. It should have been, if it was going to be there, it should have been there already. It was supposed to be at the end of 2021. Joe is there.
It is clear that DHS was pushed to have this approved, this contract approved. The project is not fully baked and we don't know where it is. Jesse is contacting DHS to come and meet with us so we can actually get an idea of when and or if this will proceed.
So do you think, Joe, that there will be another meeting set up with DHS? And
absolutely. Yep.
No, but will it involve community input?
Well, we first are just trying to find out what is the proposed time schedule. It seems, Leslie, as if this, like many other projects, were rushed through the contracting process under the last month of the Blasio administration. So they're not, these are a lot of ideas and they're not fully formed yet. That's the issue we're having.
Any other questions? Nope. The next thing is 317, the Aladdin, the former Aladdin. I think it's 317 West 45.
So
which you have the information for.
The board leadership met with our new council member, Eric Botcher. We did achieve one thing. The contract was a 5-year period. It's now shortened to 2.5 years. We still have asked what is the cancellation period for it. And that is, again, remember, this particular building was agreed to be closed by the de Blasio administration, and it was used temporarily for COVID quarantine, which of course we all understood. And now it is being used by Urban Pathways and CUCS as a sort of transitional facility or safe haven. It's really not quite clear as to what it is. We have asked for this to be converted to a permanent use. The council member is very interested in doing that. And the response we've given him is that we would like to work with some sort of permanent housing use here. And we're waiting to meet with him again. He is in touch with the owner. And one of the concerns here is, as long as the owner has a contract from DHS at a very high daily reimbursement rate, there's very little incentive to convert the building to permanent affordable housing. We expect to meet with the council member again sometime before the end of January, and then with the owner sometime in February. So we're going to be reporting back on this, hopefully to move this to a different paradigm entirely, away from just social service use, but more toward a permanent affordable housing use.
Just a little unclear, Joe. So you said that it was changed from a 5-year contract to a 2.5-year contract. When did that start, or when does it end? I mean, is that 2.5 years?
Yeah.
Good question.
Are you ready? Are you ready, Katie?
Yeah.
That's a good, your guess is as good as mine, because they were kind of working on a month-to-month contract, right? And it was approved by the Mayor's Office of Contracts. Maria and I testified on this in the last meeting in December. So that's like the second week of December. And to our knowledge, we don't even know if the contract has been executed yet.
Okay.
But it would be, my guess is, having done this before, it's usually retroactive to the approval date.
And the approval date was in late 21, you're saying?
Second week of December, right?
So basically it's sort of, we think it's for the next 2.5 years, it's likely to be used.
A little bit less. The contracts have, we know it's a short cancellation period, and either the city or the providers can withdraw from it. And if there is a viable plan for a permanent affordable housing use, all parties will want to, cooperate together to make that contract end sooner. It does not mean it's going to end tomorrow, because it can't, because to put together an affordable housing plan will take at least a year, or more put together.
Joe,
again, this is very money driven. This is about an owner who has figured out a way to truly get funds from DHS. So that's what we're fighting against here.
Joe, the provider, I can't remember who the provider is, or
Urban Pathways and CUCS.
Okay, that's right. Urban Pathways and CUCS.
And for people's knowledge, also there are 12 or 13 original tenants there, and have been there for quite some time. Very long-term tenants living with shared bathrooms with a whole range of homeless referrals in different levels of capacity. So this is a very difficult situation for the long-term women who are there.
Mm-hmm. And the next thing we have, last but not least, family shelter closures, and then old and new business. The family shelter closures, I don't have any new information. I don't know, Josephine, knowing new information. And Dolores, you're nodding. I don't know if you have something that I don't know.
No, I'm nodding that it's just sad that we don't have any further information. But I do have a question for the.
I want to say this was the mayor's vanity. He wanted to say he closed them all, and he did, irrespective of people who lived there.
Yeah.
And those folks are now buffeted around different parts of the city. We just don't know what happened to them.
And as far as we're supposed to have a family shelter site on 41st Street. I don't know when that's going to happen either. So.
The building is under construction. There's been lots of issues with it.
Yeah.
HCC is assisting the tenants, advocating for the tenants. The power has been turned off in the building multiple times. The elevators have been down multiple times. This all happened over the Christmas holiday. And the developer of the property, working with DHS, as Camber Development, who was involved as the operator of the building where the Bronx fire was. So there's a lot of not good things happening in that location. And we have I think there are 12 tenants there, long-term people who are, I would pretty much say, they call Jesse, they're out of their minds right now in terms of poor services or the buildings being kept open. There was water in the cellar, a lot of stuff over the holidays we got information about.
Isn't that the same person who's the advisor to the current mayor?
Yes. No, he was on the transition committee, not an advisor.
That's what I thought.
There are many people on that transition committee. It's not like one or two people.
Yeah.
And he's not the mayor's brother, so we're doing good.
So I have a question. Don't know if anyone knows. Katie, you might know. This year's Hope Count, I had registered. And for those of you who don't know what the Hope Count is, a count that's usually done in January to try to assess the numbers of street homeless that we have across the city, so that they can have a more accurate assessment of resources needed for the street homeless population. I had signed up for it, Katie. I don't know if you did as well, and I'm not receiving any confirmation emails. I don't see anything on the website. Does anybody know if we're not having that count next week?
Dolores, it's funny. I just found myself thinking last night, hold on, it's like supposed to be next week, I think. Or, it's supposed, yeah. And I did the same thing. I signed up and I haven't gotten anything back. So in fact, I was thinking I should try and send an email or something, but I don't know if it's happening. I know, they have
Roberta,
redone
you
it
know,
sometimes.
sorry?
I'm pretty sure I got a cancellation email. I'm happy to dig it up, forward it to you, but I believe that they said in light of Omicron that they were not holding it this year. I'm happy to pass it
No,
along.
that's all I needed to know because it's not on the website and the email may have gone to my spam, but it's very important. I've done this now 7 years in a row for all of you who really care about this this particular topic. It's helpful to do this count because again, like our budget process, it allows for us to, as a broader community, the city, to ensure that we have the resources needed for street homeless services. Okay, well, thank you, Roberta. That helps. I now know that I can work the following day without being really sleepy. So that's good.
Quick question, Dolores, what time does the hope count begin?
Midnight till 4 a.m.
All right. Got it.
So I want to just thank the members of the committee and the public who made us to the end here at 8:42. We didn't do that bad. And we tackled some serious, like a real interesting thorny issue, but then we got deeply into the weeds on stuff, which is very, very helpful. I want to note again, the majority of our meeting, we have to manage it very carefully on time for February, is going to be a discussion of the social service plan for the MTA site from Housing Works. So be prepared on that. We're going to ask them for documents in advance so everyone can review it and make informed questions. And then we'll take the second part of the session going through our social service checklist questionnaire. Is there a motion to adjourn our meeting tonight?
Motion to adjourn.
JD. Second by, I'm assuming we're good. Thank you, everybody. Have a good evening.
Good night, everybody. Thank you.